in my role as the director of the National Cancer Control Programme, it's actually been a pleasure and a privilege to work with the patients who have been diagnosed with neuroendocrine tumours, and it's been particularly a privilege to work with the small but highly focused team in St Vincent's, who comprise Donal O'Shea and now Dermot O'Toole and Mr Justin Gagan, who are so involved in gastrointestinal neuroendocrine tumours. And I particularly want to thank Nicky German, the CEO of St Vincent's, and also Brian Fitzgerald, the CEO of St James's Hospital, for the collaborative approach they've taken to how we're moving nationally around neuroendocrine tumours here in Ireland. So I think in terms of announcements, we're absolutely delighted to be able to say that Professor Dermot O'Toole, a gastroenterologist at St James's Hospital and a member of the academic staff at Trinity College, has actually accepted being appointed as the National Clinical Lead for Neuroendocrine Tumours. Now, I think what is really important to understand is that this is the start of the development of a national neuroendocrine network. We're building on a number of elements in the country that already exist that we're now pulling together in partnership with the clinicians who are so engaged with neuroendocrine tumours, so that we can do our very best to serve patients in this country. In general, people with neuroendocrine tumours more commonly have tumours developing in the digestive tract, or sometimes it's in the lungs, and they may often have their surgery in the thoracic surgical unit at St James's Hospital or the other 3 centres in the country which also offer lung surgery. So not everybody, I would anticipate, is going to be seen here in Vincent's Hospital, where I'm standing today, but St Vincent's has led the charge in developing a neuroendocrinology multidisciplinary team meeting where complex patient issues are discussed and treatment is planned. And they've also had, for some time, a functioning neuroendocrine outpatient clinic. Within that outpatient clinic, they did feel a lack of an expert gastroenterologist with endoscopy experience, and that is where Dermot O'Toole will be fulfilling a role very shortly. I think Mr. German has to go through the processes of having him appointed to that role, but that is imminent. So I want people to understand, particularly those in the public or who are patients or have relatives with this whole group of rare cancers, that we're building a network in partnership with hospitals, the designated cancer centres and the expert clinicians. We're not here today to say we're announcing everything being perfect the way it will be going forward. This is the start of a journey to make services in this country as best as they possibly can be. And in the interim, I think a number of people have gone for specialised services in Uppsala in Sweden, where there are some superb people who take care of rare neuroendocrine tumours, and they do have 1 or 2 specialised treatments that will not be immediately available in Ireland because they are so rarely indicated. So we intend to continue our liaison with Uppsala and avail ourselves of the opportunity for discussions to take place with them around best practice standards and around very specialised services. However, what we anticipate achieving over the next 1-2 years or so is that Ireland itself will be able to offer patients the vast majority of services that they require in a very well constructed environment, not only here in St Vincent's, but with networked services in some of the other designated cancer centres. So all of that will evolve, and I'm absolutely delighted that Professor O'Toole has agreed to lead this initiative, and I particularly want to thank all of the people here today, but also St James's CEO for being kind enough to allow Professor O'Toole to be cross-appointed between the 2 institutions, because I think that is a symbol of considerable collaboration across different academic and hospital groups, which I think, notwithstanding the excellence of developing hospital groups in the country, for national programs, especially for rare diseases, collaboration is absolutely vital.
You know, there's good days and there are great days, and I think this is a really great day because we have the lead of the NCCP announcing a national lead for a rare tumour group that's been close to my heart for I think 21 years. I mean, there's 4 meetings come to mind as I was just listening to the talks. The first was 1992 in Hammersmith, where I was a nervous SHO and my first weekend on call, and I went into the on-call room and the paper lower down, and there was Justin Gagan sitting behind the paper going, "It'll be grand." And then he went back in behind the paper. And we've worked really closely together across obesity and gut endocrine tumours, you know, since then, and it's great. The second meeting would be 7-8 years ago when I was back in this country, and Tommy arranged to meet Donal, brackets Maguire, but he was too busy, surprise, surprise, and he got to meet me and said we need to do something about the management of this relatively rare tumour group in Ireland. I think the third would be a meeting. I've only had one business meeting in my house. Kieran Sheehan was there, Dermot was there just after he came back, and Kevin Conlon was there. And that was to discuss, and that was 2007, that was to discuss a day like this and a structure like this, because it's all about process. It really is all about getting the right process in place. And then I think the other meeting would have been the NCCP with Tom Keane and subsequently Dr. O'Reilly. And throughout this time we've been saying the same thing. We've been saying what we wanted. And everybody has been saying the same thing, pretty much. So any time they tried to catch us out around the corner, who's really looking for what, they just kept on finding out we just wanted the same thing, a process in place for the best pathway of care with the right man when he came back to the country in charge. And then there was a slight blip and he left the country again. But, that didn't work, and that's fine. So we got where we wanted to in the end. It's a very good day, but it's the beginning of a process. And, it will be onward from here. I think it really will. And I'm certainly very proud to have been a part of it. And desperately want to continue to be a part of it under Dermot's leadership.
I think the concept of this has been not a St. Vincent's enterprise. That's not really the way anybody involved in it sees it, I think. It's very much an attempt to structure a national network that closely integrates the expertise available among clinicians in Cork and Galway with the clinicians who are here. And I think it's sort of it's kind of interesting to look back on the way cancer services have developed in this country. I think the competitive urges that drove hospitals apart have really melted away, and I think the NCCP are either responsible for that or they came along exactly at the right time to exploit. I'm sure they're responsible for it. But I think the ability of St. James's and St. Vincent's to create a structure where Dermot O'Toole can fill this really critical role here, it's just been an essential part of the process. And I think the work behind the scenes between the two CEOs and Dr. O'Reilly has just been really, really important. It's been I've been staggered at how smoothly that went. Road bumps ahead, sorry. I've just jinxed the whole process, I'm sorry, it just came out. The other really important component of the collaboration, of course, is the patients. This is a patient group that has valuable experience to contribute to the process. I have the misfortune to work with some other diseases where that really is not reality, unfortunately. But I think the experience that the patients have is critical. And I think that the clinicians are all acutely aware of that. So I'm just going to say, great day, the beginning of a process, and thank you very much for everybody who set it up.
But I think this has been a difficult sort of process, one that's moved fairly smoothly and fairly rapidly. And I suppose it's not the first person to be appointed to some sort of a cross hospital collaboration in Dublin, and in two public hospitals, that is. And that's I think that's a great sharing initiative, and I think especially Mr. German, you've been outstanding with this in mind, and thank you very much. Dr. O'Reilly as well for this initiative, because it involves not only the neuroendocrine tumour but also the exocrine pancreatic cancer group that I also work with, and that's a very important part, but it's not for today. This concept, in fact, has been going for a long time. I came back from working in a big neuroendocrine tumour centre in Paris in 2007, and I don't think I had been a day in the job, and I got a call from Professor Donal O'Shea, who sort of said, look, we set up this neuroendocrine tumour clinic, which they had, and I was invited to participate, and I brought some of my patients. We've been doing that ever since. And so the initiative, in fact, around multidisciplinary care in Ireland for patients with neuroendocrine tumours was started by Donal, and really this has been pushed through by you in a very, in a great way, and great credit to you for doing that. I've been involved now at this meeting that's every 2 weeks, and we see quite a few patients. And I have to say, I'm also chairman of the Neuroendocrine Centre of Excellence Initiative with a society in Europe. It's a big group called ENETS, and we have now almost 30 centres of excellence throughout Europe, all working at a homogeneous same level, where they're audited by independent ISO or European accredited partners. And I really hope one of the big ambitions is that we can get to that level fairly rapidly. Susan mentioned some of the treatments are not available, and some of the diagnostic tests are not available, but we're not unique, and it doesn't prevent us for becoming a centre of excellence if we have the access to that, and it has to be access that's fairly readily accessible. Justin saw a patient last week who we discussed for complex surgery with a group in the UK. We were discussing a patient with people in Rotterdam the other day because they had special expertise. You've heard about Uppsala. Uppsala you know about. Some of you have been to Uppsala as patients, but it's not only Uppsala. Another patient very recently went for a second opinion to my old boss in Paris, Philippe Rosniewski, who's an outstanding individual. And I was very proud to say that he came back with a letter concurring exactly with what we said. Hopefully that treatment will ripen as a first line. But it just goes to show you that there is great cooperation, not just within James's and Vincent's, but also on a much bigger level. And I think the important thing is to have the access there. We have a number of specialists who've been involved in our meeting every 2 weeks. And so Donal is an endocrinologist, Justin Gagan as the lead surgeon with Amir Hoti. And, not just GI surgeons, but also transplant surgeons with great expertise. And they're always at the meeting, so that's wonderful. With Kieran Sheen and Neil Swan as the pathologist. We have 2 excellent radiologists who look after us, Stephen Skeen and Colin Collins. I knew it. But just to show you, that's the whole team. And we have Lisa Cullen. Where is Lisa now? Lisa is there. I'd like to welcome you on board as well. So Lisa's taken over. Lisa is Lisa 2, but now has become Lisa 1. And you're already not too long on the job, and you're doing extremely well. And it's great to welcome you on board. You're only here for 2 days a week, and hopefully we can expand that with time. But that's really good, and already you've made great inroads, and that's fantastic to have a dedicated person to this job. And Gigi, who is our registrar and who's been looking after organising the MDTs with Lisa and really doing great work in smoothing this whole concept and seeing the patients in the clinic as well. So you can see that even within the small network that we have, there are a lot of people involved, and our plans with some help and support is that we're going to enlarge the structural support around the physicians and the carer group, and also link up strongly with 2 satellite groups, one in Cork and one in Galway. And we've had not only informal discussions, but we had a formal discussion because we met last November where the pathway for developing this program was put into plan. And indeed, Christor Sudawan in Cork with Derek Power, an oncologist who have a great interest in neuroendocrine tumours, but also Marcia Bell, who's an endocrinologist, and Dr. Gregory Leonard in Galway, who's an oncologist as well. They're going to be sharing in this network, but we've got to work on that and develop that. And like I said, it's not smooth, but I really think that it is possible to achieve a level within a very short time. My ambition will be within 2 years to apply for European accreditation through the European Neuroendocrine Tumor Society. With that in mind, I think we probably have to have a proper registry database that's running very smoothly, etc. Looking at all our key performance indices that will be regulated through the NCCP, because this will be an NCCP controlled structure. And I think that's sort of really where we are. And maybe Justin or Donal might want to add a few things to that. I think that from the patient's point of view, I've had great cooperation with the patient body. We continue to work with Uppsala. I can't ignore the fact that I hope that we have less reliance on Uppsala with time. I think that the vast majority, Dr. Riley mentioned, the vast majority of patients never have to go to Uppsala. The treatment is not indicated, but a certain number might have to. And it's great to have that facility, and it really is. And they're great pals and wonderful physicians, although their structure is changing a bit as well, but they're doing great and continue to do great work. So I think that the patient group has been exemplary. We always say that these are rare tumours with a high prevalence, so that people are living a long time with them. Some of them are, and some of them are not, because there are small percentages that are aggressive. But the vast majority of patients live fairly well, but it's still complex, and we need to get all of the players around the table to try to fine-tune the therapies. And that's our ambition. And you've been great in helping us as well moving forward in this field. So we certainly look forward to a very close cooperation between the patient group. I know that you've got ambitions to have another meeting in November. I'm not sure that the doctors group will have a further dedicated meeting, but we might have a business meeting around that time or something like that to coincide. And if we can help out, we'd be delighted to do that. Also, just to mention, for our partners in the pharmaceutical industry have been very good to us over the years in supporting initiatives around neuroendocrine tumours, and I think that's just important to signal them out as well.
We set up formally in November, and in the 7 short months that we've been together, we have a very good active group of committee members, and we put out a website which is now live and up there on the internet. And the idea behind it is that when we get our diagnosis, it is a rare condition, and there's not a lot of information, certainly not anything with an Irish particular focus on it. So we get told, or certainly in my case, I was told to look at certain websites, and it's international, and you don't know, does it apply in Ireland? How relevant is it? So we set about the main tools of our organisation going forward will be this website. And what we want to do is try to gather as many NET patients in the country to come together so that we can help each other. And one of the big things as a patient who's been diagnosed was meeting other people and in the same condition as me, and talking to them and finding out how they deal with it, what's happening, what treatments they're getting, and all that. And it gives you great hope and belief that this is not going to be a defining condition for me, but that I can go forward and live my life and really be active and just on the side dealing with this thing as we go forward. So we put the website together, and what we've done is we've tried to focus it in such a way that it presents information that's relevant to people in Ireland, as well as giving general information about the condition and the sort of treatments and scans and such like that's available, but also what is the structure in Ireland, and we hope to enhance that as things go forward with the milestone of today. What we want to do is try to get patients together and talking, so we're arranging a collection of meetings around the country, just small get-togethers, because obviously there are a lot of people maybe older who can't travel or can't come to Dublin for one event in a year. So we're arranging meetings around the country, and we hope to use the website as a tool to coordinate that. And then we also want to organise a National Patient Day each year if we can. So hopefully we'll get the support of the doctors in doing that. But today is a big milestone for us, and we thank Dr. O'Reilly of the NCCP for starting the process now of putting a national structure together. And we very much welcome the appointment of Dermot as the national lead. I think we're very blessed to have such an internationally recognised leading expert in the field to bring this forward as we go from here. But we also want to thank Donald O'Shea and Justin Gagan for what they've been doing for years in providing the neuroendocrine tumour clinic, and of course the other hospitals in Cork and Galway, and Christopher Sullivan, Derek Power, Greg Leonard in Galway. And what we as a patient group would hope that we can be a part of the new structure as it goes forward, to give patient-centric feedback and recommendations or advice from our side as to what's happening, what's working, what's not working. But we certainly see this as a hugely important day for us as a group of patients, and we believe it's taking steps forward to making sure we all stay alive for longer and live good lives.
Putting the structure on this system will allow us to go forward in a much more meaningful way. The people who are in the system now, I think, do pretty well. The most important thing is that people who are not in the system can identify the right people to come to and can get access to that system rapidly. Of those who are actually in the system now, there's a lot of fine-tuning to be done, and I think that all of the patients have to be managed, that is, diagnosed and treated and looked after according to absolutely the best international standards. We know what some of those standards are. Some of us are involved in defining them a little bit better, and we've got to put the Irish context into an international programme.
In your own case, how significant an occasion is it for you? Because you've been interested in this disease for quite a long time, but to see Ireland now reaching this stage where it has a national lead and a structure, how significant is that for you personally?
I think that, I tend not to personalise things, because I think that once you do, you lose sight of the overall goal and ambitions. And of course, the ambitions here are to bring really a group of experts together in a more meaningful way and enhance all of the skills, and they're varied, and some of them are very high level. So this multidisciplinarity that we talk about now in cancer care, not only in cancer care, and other care as well, is really 100% pertinent for this group of patients. The tumours in these patients can be really indolent, slow growing. Some need never treatment, and others need quite a barrage of different treatments, and when to know when to give one and not to give it, and at the timing, etc. It's quite a complex issue, and no one individual can decide on that. I think that what we saw here today with people like Professor Donal O'Shea and Mr. Justin Geoghegan and the other pancreatic and gastrointestinal surgeons and transplant surgeons, etc. here, to have that combined expertise is vital. I would single it out as a team effort, and that's the only way we can achieve meaningful success going forward. I think that team is just, it's not just the physicians as well, it's outside of that. It's having specialised nursing care, specialised support. The input from the patients is vital. The input of yourself, Tommy, but also the leader of the patient group, Mark, and the others has been really important in bringing it together, pushing the doors that little bit further open. And I think that together we can open the door really fully, and that's the objective, but only as a team.
Well, I think this is the first step on the road to truly international class best service for patients with neuroendocrine tumours in Ireland, and we've got everyone in place. It's the start of the process, as Professor O'Toole said, but he chairs the European Centre of Excellence on gut endocrine tumours, and he's going to lead Ireland to international accreditation over the next 2 years. This is So, by the end of 2015, we could be formally recognised as providing best practice. So I'm delighted about that. I'm delighted that we have got exactly what we were looking for. We've been looking for it for a long time, but we only really got an outline commitment to it 6 months ago, and it's been delivered. And by any standards, institutions don't move that quickly in this country. So it's a real breakthrough.
What do you think it means for patients?
I think from a patient's point of view, it should deliver, well, number one, confidence to them that we're, if you like, that we're all singing off the same hymn sheet, and that we're aiming at the same thing, which is a standard of care that means they know they're getting the best from the best available in Ireland, and when it's not available in Ireland, they will get exactly what they need in an international centre of excellence. So 95% of what we need to deal with carcinoid and gut endocrine tumour patients we have in Ireland, but the 5% that isn't here, they get at the time they need it, not 18 months after they need it. I think that's really important for the patient to know, for the families to know, and for us as kind of caregivers to know that the patient will get exactly what they need, when they need it, where they need it.
Well, I think first of all, for neuroendocrine cancers, patients are facing a rare tumour, a whole variety of somewhat different tumours, and treatment choices that are complex, but luckily in a situation where people can sometimes be cured or other times can live for many, many years with their cancers. So historically, there hasn't been an integrated national approach to being able to look after people with these uncommon cancers, and individuals have either been seen in designated cancer centres, or sometimes they've taken advantage of excellent assessment and treatment in Sweden, in Uppsala. We're now bringing together a national neuroendocrine tumour network, which will have a role in developing a national programme for Ireland. And I'm delighted that today we're announcing the appointment of Professor Dermot O'Toole as the national clinical lead. And Dermot himself is a gastroenterologist who has many years of outstanding experience both in Ireland and in Europe as a leader in the treatment of patients with this rare cancer. So I'm very pleased that Dermot O'Toole has taken on being the national clinical lead, and his job will be to work with the National Cancer Control Programme and the leads in Dublin, in the Designated Cancer Centre, and Cork and Galway to develop the networked approach for patients so they can be assured that they're getting the best treatment for their condition here in Ireland, similar to treatment they would get anywhere in the world. And occasionally, under certain rare circumstances, if there are very specific uncommon treatments, we will of course take advantage of our excellent colleagues in Uppsala in Sweden, who also offer some additional interventions that can be very helpful. So out of the appointment of Dr. O'Toole, Professor O'Toole, I will expect to see a network evolving where we have services in Cork and in Galway and across St. Vincent's and St. James's, and to some degree the other two designated cancer centres here in Dublin, which reflect on where patients best need care. Patients with thoracic problems may start off in St. James's. Patients who have upper gastrointestinal and pancreatic tumours are most likely to come through St. Vincent's and be seen by a multidisciplinary team here in St. Vincent's who will be able to advise them on their next steps. So this will definitely be networked. It'll definitely be national. And this is the start of a journey, but it's the key step in developing a very sophisticated national programme.
What sort of timescale do you think is involved in completing that journey to your satisfaction?
This year will be developmental, so I would expect to see progress in 6 months and 12 months. I expect us to have a fully fledged national programme running smoothly within 2 years. And what will that look like? It will mean that there will be certain referral pathways for different types of cancer that are clearly delineated. Patients will be treated by international evidence-based standards, and furthermore we'll be monitoring the timeliness of access and the appropriateness of access through national performance indicators.
It's a big day, really.
I think it is. I think it's great for patients with neuroendocrine tumours. It's also great that we can engage with the individual consultants who've got considerable expertise and who are working as a collaborative team to offer even better services.